Hi, I'm Jules, and this is Music and Love Heal. The purpose of this video is to give students a better understanding of the anatomy of the vocal instrument. The more you understand how your body works, the better you can learn to optimize usage of your voice in a healthy and holistic manner for maximum benefit. The majority of this research is derived from the excellent book, Anatomy of the Voice, an illustrated guide for singers, vocal coaches, and speech therapists, written by Theodore Dimon. I am including a resource guide in the description box, and I highly recommend serious scholars obtain this reference manual. Let's start with the diaphragm and work our way up to the torso. To review what we've been talking about, the diaphragm is the muscle below your lungs or thoracic cavity and above the abdomen and acts as a partition between the upper and lower parts of your torso. When you inhale to the bottom of your lungs, the diaphragm moves down, creating space in the lungs for air to rush in as the vacuum effect in physics. While this is occurring, the intercostal muscles, which are the muscles between your lungs and ribs, engage to help expand the rib cage out, creating more space for the lungs to expand laterally. It is useful to imagine the singing breath as an expansive, energetic force that encompasses the entire torso, front, sides, and back. In this way, you are maximizing the expansion of the lung cavity, improving lung capacity and breath retention so you can hold phrases longer and ultimately have more control of the sonic and expressive capabilities of your instrument. Let's take a closer look at the respiratory system. The pharynx is essentially your throat, and pharynx is actually the Greek word for throat. The pharynx extends from the nasal cavity and mouth to the esophagus and larynx, which is at the top part of the trachea. The trachea, also called the windpipe, extends from the throat down into the lungs as it divides into two bronchial tubes, which further divide into progressively smaller airways that resemble tree branches. Through this process, oxygen exchange occurs between the lungs and the blood, helping circulate oxygen into the bloodstream and throughout the body. Essentially, the oxygen you breathe in travels down the trachea into the lungs, through the bronchial tubes, and diffuses through the thin membranes of the alveoli and capillaries, which closely resemble the ends of the tree branches, into the veins and bloodstream. The trachea sits in front of the esophagus, which is the muscular tube that connects the throat to the stomach. The larynx is essentially a valve at the top of the trachea or windpipe. When we inhale breath, the muscles of the larynx engage and the trachea opens, allowing the air to go to our lungs. When we swallow or hold our breath, the muscles of the larynx close the opening, so liquid and food cannot pass through and get into our lungs, although we've all experienced that and it does feel horrible. The larynx, also called the voice box, produces all vocal sounds and contains components that make up the vocal instrument. Our vocal cords are located in the larynx, positioned horizontally back to front. When we produce sound, either speech or singing, the vocal folds come together repeatedly, called oscillation or vibration. And continuously, they vibrate together, creating sound waves that then resonate into our face and head before traveling out into the universe. The tension of the larynx, as well as the stretching of the vocal folds, affects pitch, volume, and tone. The airflow generated from the lungs is the power source sent through the vocal folds to create the sound, which then resonates in the mouth and head to form the characteristics of the sound, i.e., vowel or consonant shape, bright or nasal or heady or forward or woofy. To understand resonance, let's think about singing in the shower and why that is such a great experience. Essentially, the tiles of the shower are reflective, not absorptive. This is so the water is not absorbed. If the water was absorbed, you would have a very moldy shower. Sound waves work the same way. When you sing in the shower, the sound waves bounce off the tiles, generating harmonic excitement that creates and amplifies the sound, bringing forth better sonic qualities. In contrast, if you go to the basement and sing in a heavily carpeted room with a lot of curtains, the fabric will absorb the sound, making the resonant qualities of your voice disappear, so it feels like you're singing into a void, and it's not very nice to listen to because you don't get any acoustic resonance back. In the singer's face, the vocal sound resonates, or we can think about becomes amplified through the resonators, which consist of the throat, mouth cavity, and nasal passages. The sound is further modified by the articulators, which are the lips, tongue, and jaw. These elements further shape and form the timbre, color, vowels, consonants, words, and oftentimes emotion behind the singing. In addition to the vocal folds, which you see are part of a complex intrinsic and extrinsic muscular system, the framework of the larynx is made up of various types of cartilage, which is flexible connective tissue. The vocal folds are primarily attached to the cricoid and arytenoid cartilages, which assist in their movement based on which register you are singing in. Moving on, we have something called the epiglottis, a large flap of cartilage or tissue situated at the front of the larynx, and this protects the larynx during swallowing, and essentially it closes to prevent the inhalation of your food between the vocal cords. And instead, when this closes, the food and or liquid is directed to go to the esophagus, which leads to your stomach. The glottis is the space between the vocal folds and ligaments that opens and closes. It closes tightly when we swallow, cough, or hold our breath, in addition to producing all vocal sounds. The lips of the glottis come together to produce the vocal onset of sound, and it is the proper control of this mechanism, i.e., not too aggressive or forced, that creates a healthy tone. The supraglottis lies above the vocal folds, between the vocal cords and the base of the tongue, while the subglottis sits below the vocal cords towards the trachea. Within the interior of the larynx, amidst all of the cartilage and muscle fibers, are your two sets of vocal folds, called either the false vocal folds or the true vocal folds. The vocal folds used for traditional phonation, including speech and classical or contemporary singing, these are the true vocal folds. They are two bands of smooth muscle tissue, deep pink folds of mucous membrane. The inner margin of the vocal folds contains two white ligaments. They open during inhalation and vibrate continuously, Think about blowing through two blades of grass. And this is how sound is generated, which is powered by the airflow from the lungs. The vocal cords stretch and vibrate faster and more frequently to make higher pitches. The inner margin of this system of the vocal folds is known as the vocal ligament. The false vocal folds are not elemental in creating traditional sound or phonation, but they are used in non-traditional singing frequently. They serve generally to assist the true vocal folds in closing tightly, but where the false vocal folds become widely used is in non-traditional singing functionality. They are used to produce deep tones, screams, growls, and the multiphonic sounds presented in Tibetan chanting and Tuvan throat singing, where one singer is able to sing two or more pitches at the same time. I highly suggest you Google this. So, as you can see, the vocal mechanism is incredibly complex, with numerous cartilages and muscle fibers that coordinate to help move the vocal folds and the surrounding tissue in your various registers of chest, head, mix, falsetto, etc. For the purposes of this video, we will keep the discussion on a fundamental level, but if you are interested in knowing more about the anatomy, I encourage you to pursue this line of research. Expanding a bit on the previous vocal hygiene video, I would like to show you some potentially disturbing pictures of what kind of damage can occur with improper use and poor care of the vocal instrument. Let's start with common inflammation of the vocal tissue surrounding the cords. When the larynx and the surrounding mucous membrane become inflamed, the cords do not vibrate together properly. Frequently, this kind of inflammation leads to hoarseness, loss of vocal strength, or laryngitis, which is when you can't make sound at all. It is caused by overspeaking, oversinging, yelling, coughing, screaming, having a cold or respiratory illness, postnasal drip, acid reflux. There's many causative factors. When you find yourself feeling hoarse and inflamed, the absolute best thing to do is stop singing and stop talking until you are able to figure out exactly what is wrong in your voice. Often, the best remedy is lots of sleep, lots of vocal rest, and again, rehabilitation of any underlying health conditions that you're going to have to figure out. If you do not properly take care of the inflammation, which is sort of the step one warning signs, and you just keep using your voice, this then can lead to lesions on your vocal folds called nodules or polyps. A vocal nodule is a benign, non-cancerous growth on your vocal folds, kind of like a callus. But if it's not treated immediately and you ignore it, the nodules become larger and potentially more damaging to your vocal instrument. This can also lead to polyps. A vocal polyp is usually larger than a nodule and resembles a blister. This is also often caused by vocal overuse and abuse coupled with poor vocal hygiene. One can also get vocal cysts or vocal hemorrhages. Severe vocal issues usually result in an extended period of complete vocal rest, which translates to often canceled tours, lost money, and in many cases, it has to be resolved with surgery. So ideally, you want to avoid getting into this situation in the first place. This is why I highly encourage the study of classical music as a means of creating an excellent technical foundation for your singing endeavors. We're going to keep this channel informative, educational, and hopefully inspiring. Please like, share, subscribe, and thank you for being with me on this journey. Drink water, breathe, sleep, and honor your body. Namaste.